One of the most frightening things that a parent can be told is that their baby's umbilical cord is wrapped around their baby's neck. The reason why I know this is because we get a lot of people who comment and ask questions online and offline about this. And especially when a baby has suffered a traumatic brain injury like HIE, parents will then begin to wonder, okay, this umbilical cord wrapped around my baby's neck, was this the cause of everything? So first of all, when an umbilical cord is wrapped around a baby's neck, that medically is called nuchal cord. And believe it or not, nuchal cord is fairly common. A lot of babies will experience nuchal cord. And for a lot of these children, it will be okay. It's not going to cause any problems. But where nuchal cord can become problematic is when the cord is wrapped extremely tight. It's a tight cord, and the cord it causes cord compression. The umbilical cord becomes compressed because of the cord being wrapped around the baby's neck. And in some instances, it can be wrapped around one time, or in other instances, you can have 2 or 3 times. It can be wrapped multiple times. And for babies who have suffered a traumatic brain injury like HIE, hypoxic ischemic encephalopathy, that is a reduction in oxygenated blood, which leads the baby to suffer a brain injury. So when nuchal cord is present and you do have cord compression, then that cord compression can, in some instances, it can reduce the level of blood and oxygen getting to the baby, which can then lead to a brain injury for some of these children. When nuchal cord is present, and let's say you're going through pregnancy and the doctors say that they see a nuchal cord, it is extremely important for mothers to pay close attention to how their baby is doing. Like things like, for example, decreased fetal movement. If that is going on, that's definitely a sign that you want to speak with your doctor and you want to talk with your doctor about that. During labor and delivery, when you have umbilical cord compression, what you can also see is on the readings on the electronic fetal heart monitor, there will be a drop in the readings for the monitor, the baby's heart rate. It may get down into a condition what we call bradycardia. So although nuchal cord is fairly common, some babies are going to be okay with nuchal cord. In some instances, it can be problematic. From a medical legal standpoint, when we're looking to see the cause of a baby's traumatic brain injury, we are looking at, when we are reviewing the medical records, when we are reviewing the readings from the electronic fetal heart monitor, we are looking to see, is there a sudden drop in the baby's heart rate? And if you do have that sudden drop, how long does that occur? Is it in the bradycardia area? And if you do have this drop, what did the doctors and the nurses, what did they do to try to remedy this situation? If you have more questions, maybe you're watching this video today because your baby has an HIE diagnosis and there was a nuchal cord present, and maybe it was a tight nuchal cord, and you have questions as to, did this cause your baby to lose oxygen, blood and oxygen, and now has suffered a brain injury? Maybe they have an HIE diagnosis or a subsequent CP or cerebral palsy diagnosis. If you have these types of things going on, what I invite you to do is go ahead and pick up your phone, get your cell phone, and give me a call. There's a telephone number down below on the screen. I invite you to pick it up and call me. I speak with families about these types of issues all the time. We talked a little bit today about HIE. We talked about nuchal cord, cerebral palsy, MAS. This is what we do. When you contact my office, remember, it costs absolutely nothing initially to talk with us about what you've got going on. Remember to, when you speak to my secretary, remember to give them a date and a time to get on our calendar. They're going to give you some, dates and times, what we have available to talk. Make sure that you talk with them about a date and a time. Also, give them a good email address. We need a good email address because sometimes we need to be able to contact you by email, and we need a good email address. One more thing before I get out of here. I practice law here in the state of Maryland, and I know from time to time we'll have individuals who will contact us, and they are not in Maryland. They're in the United States, but they're not in Maryland. Please understand that if you contact us and you are not in Maryland, we have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can work to help you on or help you with. But I just want to make sure that you understand that co-counsel, that local counsel aspect of things if you are not here in Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. Talk with you next time. Take care. Enjoy the rest of your day.